Some of us didn't believe it, some of us didn't really see it until it started to hit home. Once it hit home, it was a reality check. Almost every other call is a COVID-19 positive.
So diabetes and hypertension is the medical history.
Thank you.
He's been tested, but the tests are not, he hasn't received the results yet. I'd like to take him over to the hospital, get him checked out. So we'll go with difficulty breathing. ¿Cómo se siente, señor? ¿Mejor? ¿Con la medicina que le di, se siente mejor? Okay.
Santa Ana is one of the communities that has been seeing a lot of the COVID-19 patients. I don't allow it to disturb how I think. I don't allow it to make me anxious, because if I become anxious, then I can't think straight. In Santa Ana, we've seen the numbers of COVID-19 cases increase. So many Latino patients, many people who are maybe who do not speak English that well, who may not be well versed and educated into this whole thing. And we try to reach as many people as we can by talking to them, by going out on calls and talking to the family members. And so, yeah, the Hispanic community is, we all need to be aware.
We have many communities impacted by poverty and exclusion in this county that has a very affluent community and a very poor community that works for the affluent community. The virus continued traveling towards central Orange County and found a very vulnerable community, a community that couldn't stay home, a community that was living in those overcrowded conditions, and a community that couldn't implement preventive measures of distance, for example, when you live with 10 people in one small place. We started seeing cases in Santa Ana and Anaheim, and more cases, and then people dying, the huge numbers in the zip codes in comparison with the rest of the county. The rate for a zip code being 3 times the rate for the county in a zip code.
Today, we're hosting a mobile clinic, a community clinic at Anaheim High School. This school is located in one of the most impacted areas in Orange County. I live in this community. This is my home. This is my high school that I graduated from, that my family, we all went to school here. Sometimes families are maybe undocumented, right? And they feel like if they get any kind of help from the county or the government, then they're gonna have like records of them or something, and it's gonna affect them. So we tell them, this is for anybody, this is free.
So it's testing with equity big time. It's also what do you do after you test positive. Now you need to isolate, but you don't have food. So we came up with this strategy also in which we deliver food to their homes. We got in a partnership with a local grocery store, and they prepare a basket that we give to them. So we are telling people, we have your back. We will give you food. Just stay home.
Hola. Hola, sí, dígame, mire, señora Socorro, usted me dejó aquí un número de teléfono.
So what we do as part of the call center, it's usually we get a feel of what their needs are. They call in and they usually want a testing site. Once they ask me if there's a testing site, and then later on they start telling me the story, I get a feel of what their needs really are. So like she wanted a testing site, the lady that I just did, but she told me, what else can you help me with, because I haven't paid my rent in the past month. When you see your neighbor struggling, when you see someone struggling and that you can help out, you have to. It's like, it's a must.
We don't want to just do things so people can be better today, because at the end of the day, what has been happening for these 27 years created the vulnerability for COVID. So we are not just COVID, today. We are saying COVID today and what tomorrow and what the day after tomorrow. And I think that's what is making a difference, that we are not waiting for the vaccine to recover. We have started recovering already.